Hi guys, welcome to the channel. I'm Dr. Sylvia, a family practitioner or general practitioner, and I'm so glad you're joining me this evening. Welcome. How are you doing? Welcome to another new week. And last week in September, the year's nearly over. We're nearly done with 2024. But yeah, how's your weekend been? Thank you so much for clicking on. I know that these topics that I've set for today's stream are of particular interest, so we're going to dive into them in just a few moments. But just in case you've come onto the stream and we've not met before, I'm Dr. Sylvia. I'm a GP based in the United Kingdom, and we love to discuss things that are related, particularly to women's health, but also sexual and reproductive health, family health, which of course can include men, children, and everyone in between. So it's everybody that we like to discuss on the channel. I also run the website AskAwayHealth.org, which is a health information website, and you can hop on there if you want to get much more information on a range of different conditions. And there we also have a health information service that allows you to post questions specifically to the doctor, to our clinical team, and get a response that's tailored to your needs. But tonight we're here on YouTube and Facebook. So hi, thank you so much for joining me. And yeah, messages, please don't forget to give this video a like, and do subscribe to the channel if what you hear is useful and you think that you can share this with family or friends, and you're absolutely welcome to do that. I'm going to be addressing a few comments that have come through the channel in the last couple of days, and I've done similar things in the past. So if you want to see some of our other videos, please make sure you check our live stream playlist. But I always preface our discussion or conversation with my disclaimer, because I am not anyone's registered medical practitioner here on Facebook or on YouTube or any other social media platform for that matter. So it's really important for me to emphasize that what our conversation is about is for educational purposes. It is not to replace the advice that you're going to get from your own doctor, who knows all your medical background, who is able to examine you thoroughly and then arrange tests. So we're simply going to have conversations that can probably signpost you, point you in the right direction, and help you, with perhaps understanding things that are not very clear, guide you in terms of what to ask your doctor to just help you make sure that you get the right care for yourself. So before we go into that, reminder, please, if there's anything around the topics we're going to be talking about you want to ask around, please feel free to use the comment section to share your thoughts or to ask your questions. And before I forget, really looking very much forward to next month, which is literally a few days away at this point, but it's menopause awareness. And I shared this on my community not too long ago. So we're going to be having perimenopause chats. They're starting next week, Thursday. And it's simply a series of videos that I'm going to be putting out around the subject of perimenopause/menopause. So this is your opportunity. If you've got questions that you've been wanting someone to answer, please let me know what they are. I could include them either in one of my edited videos, or I might dedicate a live stream to just put in a couple of questions that come from the community and then tackling them on a live stream like today. So please keep an eye out for videos coming twice a week for the next 4 or 5 weeks while we're all sort of marking menopause awareness. I'm dedicated to just helping to shed a little bit more light on the things that we're maybe not very clear about, or just wanted some clarity around menopause awareness. So that is that. Okay, so let us, without further ado, get into the first of our questions for today. And if you're joining, if you're sort of sitting back and watching, not wanting to say anything, just being very quiet, you're very much welcome. That's fine. I totally understand, but I appreciate your clicking on the video and sticking around to hear the answer to the questions. So we've got 3 tonight. And as the title says, we're talking about things to do with period blood, things to do with genital warts, and things to do with fibroids in pregnancy. So let us begin after a brief message while I just sort out a few things with my technology, get a sip of water. I shall be back in just a moment. Okay, amazing stuff, great stuff. Thank you so much. So first question, and thank you so much to the viewer who sent in this question. They say, I have genital warts in the vaginal wall. What can I do? Very simple, short question. And good opportunity for me to say that I have a either 2 or 3 at least videos, maybe 2 videos on genital warts. I talk about what they are, what causes them, but I have one that's dedicated just to treatment. Just treatment. In fact, I think what I'll do is I'll link that in the description box below, because they're not going to go into too much detail around that. But yeah, genital warts in the vaginal wall. To be fair, what to do, I think, for an individual in this position is you really need to see your doctor. And if your doctor decides that you need to be seen by a sexual health specialist, that's, fine. Depends on the extent of the warts. It depends on so many other things, your medical background, things that can determine what treatments they are. And just as a way of refresher, genital warts are lesions or conditions caused by the HPV, human papilloma virus, and they can be transmitted via sexual contact, as you know. So they can occur in different parts around the genital area. So when I say they are transmitted via sexual contact, so either via oral or anal or vaginal sex, either any of those ways can transmit genital warts, and they can occur around the genital area and in the mouth. So they can happen around the lips of the vagina, they can happen around the anus and the areas in between, and similar for men, they can happen around the genitals. And this of course is why they're called genital warts, because of that distinct location. Of course, you can have warts developing in different parts of the body. But in terms of treatment, there are different treatment options. And let me just share this slide I put together. And again, if you want to have very detailed insight into the different treatments available for genital warts, please have a look at the video, which I'm going to link as once I finished with this live stream. But one of the treatment options we have, of course, is no treatment at all. And I know for some people, this might sound a bit weird, as in, how can we say that no treatment? But it's actually quite true that if genital warts are left alone, which for many of us, of course, is quite difficult. But if genital warts are simply left alone to just be there, by themselves, a third of them or thereabouts will disappear after 6 months. But that's a long time to wait. And even though genital warts, they're not painful, they're not, maybe a bit uncomfortable, itchy, depending on where they're located. The biggest thing is that they're going to grow, of course, and as they grow in funny positions, they can create problems. But some of them can remain quite small. So the bottom line is that most of the time, sort of sitting and doing nothing, waiting for them to go away, is not really an option that most people want to follow. So no treatments is something that could be considered, yes, but more often, what we tend to do with genital warts is skin treatments that could be creams, ointments that are applied directly to the wart, and that will take some time. There are different medications like podophyllitoxin, imiquimod, catifen. These are creams or skin preparations that you can apply, and many of them you can actually apply by yourself. But if their warts are quite large, or if they're for genital warts in women, some of them you'll require a doctor to apply. So that's why the first thing I said was you really need to go and see your doctor so they can assess the extent. Because I presume that this is somebody who has already seen their doctor, since they're saying that they have a wart in the wall of their vagina. I presume that that's the case, that they've seen the doctor, in which case the doctor really would have offered you treatment options. But if I'm wrong, if I haven't got this scenario correctly, then, and you're suspecting that you have warts, please go and see your doctor first and foremost, so that we get the right diagnosis. With the right diagnosis, you can get the right treatment. So there are different creams and ointments that can be used. Some of them can be applied by yourself. Others will need medical supervision, or you would have to go to the clinic for them to apply the treatment, and then you go home. So it depends on what type of what that we're dealing with. Many of the treatments will come with certain side effects, so please keep an eye out, and of course ask your practitioner about them. And I would also add a proviso that pregnant women or women who are breastfeeding shouldn't use what treatments. Again, please speak to your doctor about, if you're pregnant or breastfeeding and you're facing a wart situation, please speak to your doctor about treatments or what options are available are best and safe for you, because a lot of the medicines that we have could have some effect, transfer in breast milk, or have an effect on the baby. So let's be aware of this. So other treatments available for warts, again, depending on their location or their position, there could be heat treatment or laser treatment or treatment with electric current, freezing treatment, or even cutting surgery. So I put the whole list of possible treatments on the screen so that you can see that there are different ranges or different treatment options, I mean to say. But when it comes to this specific one, what can I do? Please see your doctor. Please don't deal with this by yourself, okay? For genital warts, for warts within the vaginal canal, there are certainly creams or liquids that can be applied to them. I think the problem, if you're trying to deal with it yourself, is how well you're able to apply any treatment yourself. Again, that depends on the size, depends on the location, and so on. So there's a few things to consider, but there is treatment available for genital warts, and the best thing to do would be to sit down with the doctor and decide on the best, let them advise you, and then you can decide on the best treatment that will support and give you the relief that you need. The last thing I would say when it comes to genital warts is that, you need to be patient. A lot of these treatments take time. You would need regular application a couple of times a week, depending on the preparation, and you may need to have that for extended period of time before you begin to see anything different. But with most of them, especially the ones that you apply, the creams or the liquid that you apply, with most of them, using them consistently over time, they are effective. So yes, I think that's really the best I can say for that one, just given the limited information that we have. So thank you so much for putting that question together, whoever sent it in. I appreciate that, and I hope that bit of information is helpful. We shall go to the second question just after this quick break. Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like. Okay, so welcome back. Let's look at question number 2. And this is on, this is the period blood one. So this is a question that came through. Thank you for sending your question in. And yeah, if you've got questions, sort of general questions, information that you're curious about, or you haven't found answers in your searches online, yeah, please post them in the comment section to any of the videos that you watch, or in our community post. And I do sometimes curate questions, put them all together into a stream, or I dedicate a video to them depending on sort of the degree of interest and so on. So please feel free to use that. And again, it's not that I can provide specific advice or guidance about your own health issue. A lot of these things, I would say, please go back to your doctor, because it needs much more information than just the few lines that we have available on Facebook or YouTube to type into the comment section. Okay, so this question is, I only see my period for 3 days. For those 3 days, the blood is dark. Is it normal? Is it normal? So this, is it normal questions? They don't have a yes or no answer, particularly in medicine. There always needs to be consideration of things that are going on. So there are a few things that you can say, okay, is it normal to do this? Is it normal to do that? But, when you come up with a scenario, we don't know how it started. We don't know what else is going on. So we can't just say, is it normal or not? So I'm sorry to disappoint the person who's asked this question. I can't say it is normal or it is abnormal. I think the first thing I'll say is that it needs to be looked into. Okay, 3 days. First of all, how old are you? Let's start there. Age of this person. Have they just started having their periods? Well, I don't get young girls asking questions in the channel, so let me rephrase that. Are they sort of still very early in their childbearing years? I'm talking about teenagers, early 20s, mid 20s kind of age, or versus somebody who is approaching the end of their childbearing, so someone in the perimenopause or menopause age. And that's relevant because it tells you what kind of hormone issues might be going on, and that might explain what we're seeing. What were your periods before now like? Have you always had 3-day periods? What has something changed? So other bits of information that would be very useful to help us answer this question. I agree, it's a good question. I'm just saying that there isn't enough information to go with here. What else is happening during those 3 days? Is this something that's just developed in the last couple of days? Did you have in the last couple of months? Did you have any medication before all this started? Could there be context of other things going on? Are you getting any pain in your lower abdomen? Are you on any medication at the moment that might explain what is going on? So these are the interesting issues, or these are the interesting other facts that would help us to answer the question of whether it's normal or not. But that said, okay, I can tell you that there are certain scenarios where you can pass black or dark blood and it is normal. And I do have a video on this, and one of them tends to be around the beginning or the end of your period. And it only has to do with how heavy the flow is, how fast the flow is. Because what changes the color of the blood from the bright red or red color that we see are things like if the blood is moving very slowly or is sitting in the womb and it's sort of dripping, not flowing smoothly. It can, because it stays for some time pulled in the womb, when it comes out, it might look darker. Or if the blood comes out very slowly, as it comes out of the womb and it's exposed to air, it's oxidized, which changes the color. These are natural events. There's nothing out of the ordinary with them. So the blood can look darker, but that's either the beginning or the end of the flow. So you would have seen normal red period blood in between, and then well, this is nothing to be alarmed about. It is simply as the blood is either slowly trickling out towards the end of the period, it's slowing down, and then it's exposed to air, so it changes color. Or before the full flow gets going, that's during the beginning of the period, and you have some blood that perhaps is slowly coming out of the womb, and as it comes out of the womb, it's been sitting there for some time, and then it just looks darker as it emerges from the womb. And sometimes you might have blood clots that form, and that's blood that's congealed or that's solidified while in the womb, so that by the time it lands on your sanitary towel or sanitary product, it looks darker than red. Is not so. Those are situations that you could say, oh, it's normal. But there are circumstances where you have dark blood and it's not normal. So if you look at my little diagram here, so the flow part, so I've got black period blood at the top, and I've got the diagram breaking down into 3 different sections. The first one I've just talked about on the left side is the flow. So it depends on whether it's heavy or slow, whether it's heavy or light bleeding, if it's fast or slow bleeding, and that circumstance can happen around your periods. Of course, there are other conditions where you can have very heavy bleeding. So look at the second category on my diagram, and one of them is something like fibroids, for example, where you can have very, very heavy bleeding. And then you can develop blood clots as a result of that, and then the blood could look darker as it comes out. So it is possible that experiencing dark blood for all of your period might indicate that bleeding is very heavy, and it might suggest something else that's going on. It's not just fibroids, hormone imbalance problems like polycystic ovary syndrome. What happens there is you have irregular bleeding. Some women don't have bleeding at all for several months with PCOS, and then so it may be that some degree of bleeding that they could have had to make their periods regular doesn't happen. So when the balance changes, or when the balance is such that the womb is going to shed blood, you have a larger quantity of the womb lining that will come away, because during that time when they were not bleeding, there was still a hormone effect on the tissue of the womb, because period blood, if you remember, is a mixture of parts of the womb that were built up that got thicker as the body was getting ready in case a pregnancy happened. And another part of the period blood comes from the egg that was not fertilized. So if you imagine somebody who doesn't have regular periods, what happens is that the womb lining is building up, it's building up, it's building up till it comes to a point where it's time for all of that lining to be shed, and you have such a big volume or a big loss, heavy loss of blood in that period. And so everything just comes out. It looks as if it's dark. It might be because the tissue, the blood moves slowly out of the womb. Again, it gets oxidized. So there are different reasons, but again, that's another scenario that could suggest to you that there's something not right, something abnormal that is going on. And then, of course, there's cancer. So an example is cervical cancer, where the tissues are damaged, of course, the abnormal tissues, and then they're producing abnormal fluid. They're producing abnormal discharge. It's mixing with blood. It's the tissues. The cancer is spreading into other tissues around. So because there's damage going on, because there's a lot of inflammation going on, you're getting a discharge that is mixed with blood. It's mixed with other types of tissue that normally don't accompany a period. It's decaying, and so you're likely to get darker blood in a scenario where there's cancer, cervical cancer, womb cancer, for example. Other examples that I've got here, which could be linked to dark blood and infection. So a sexually transmitted infection, or PID, pelvic inflammatory disease, which I'm sure many of you have heard about before, that could also alter the color of the blood. And if it's an acute situation where somebody has picked up a PID because of a sexually transmitted infection, there may be other symptoms like pain around the pelvic or the lower abdomen. There may be other symptoms like feeling unwell with a fever, vomiting. All those signs of infection may come alongside dark bleeding. It may not, but it might do as well. Pregnancy is another scenario where you could experience dark blood. And when I say pregnancy, I mean pregnancy in different complications of pregnancy, let's put it that way. Well, the first one is a miscarriage. So again, blood is coming away from the womb, and it depends. The flow is not regular. The flow can be a little bit light to start, and then it gets very heavy. And in those circumstances, you could have blood that can either is sitting in the womb for some time before it begins to come outside, and that changes the color of the blood, looks different. It's the clots, because the bleeding gets heavy, clots are formed, and the blood looks darker. As the blood comes out, it's exposed to air, it becomes oxidized again. It looks darker. The other situation in pregnancy is, which is a normal outcome of pregnancy, of course, is after you've delivered and you're passing lochia, which is that discharge that comes out from the vagina after you've had the baby. And that can go through a whole different range of colors. It's heavy initially, it lightens up after the first couple of weeks from your delivery. And sometimes it can look darker. Sometimes it can just look darker simply because of the amount that's coming through. I think in that particular scenario, what I would be much concerned about is does it have an offensive smell? And do you have pain around your pelvic area or around the womb? Those are the things that could point out to an infection. But if it is a color that looks dark, and it's something, when it passes, it's not something that is constant, it's not always black. So if it's something that might be you've changed, by the time you've changed your pad, you notice that, oh, this looks dark. By the time you put on a fresh pad and check a couple of an hour, a couple of hours later, it's not looking dark, it looks different, it looks more like your pink or red blood, as to expect. So that will be normal. It will just depend on the flow, how heavy or how light the flow is, and how slowly or quickly it's coming out from the womb. So that's not something to panic about, unless you're experiencing a lot of pain or it's smelly. That I would be concerned about the lochia in that stage. Implantation bleeding, I didn't put it down here, but implantation bleeding is something that may also appear dark. Give me a second, guys. Excuse me, frog in my throat. So yes, I was saying about implantation bleeding. So this is bleeding after fertilization, and usually it's indicative of implantation really of the pregnancy of the fetus. So it is simply embedding into the lining of the womb, and so you have a little bit of blood. So sometimes this blood looks like a period. In fact, for some women, they think, oh, it's same as a period, and the only way that it may be different from a period is that it's not as heavy. It may not last as long as a period, but you don't really think about it at that point. It's in retrospect that you realize that, oh, actually that period I had didn't feel like a normal period, and that's when you realize it was actually implantation bleeding. But for the reasons I've given already, in terms of how heavy or light it is, for those reasons, the blood could come out and it looks a little bit darker than usual. So, like I said, there are different reasons. I think there's one more here. Yes, birth control. Some birth control pills, of course, that will affect your hormone balance. So that will also affect how light or thin or heavy your womb lining gets from, 1 month to another, depending on the method. And again, that could affect how much blood comes out of your womb through the vagina, and affect what color it is. So back to the question, is it normal? There is 1 or 2 instances when period blood can be normal. It is usually at the beginning and at the end of a period, and that's normal. In terms of this question, I would say we need to look closely at what is going on. Is this something that is happening for the very first time? Okay. If it's not, when did it start to happen, and what other circumstances were going on around passing black blood? Could it be linked to the reason why your period is shortened? Are you having any other symptoms that might indicate whether it's associated with an infection? Are you taking any medication? Because some medication, for example, blood thinners, could affect the flow of your blood as well and may affect the color. So a few things to think about with that question. What I hope I've sort of set you on the path of going to sit down with your doctor to say, I've noticed this and it's different to what normally happens, and I would like to know whether it's normal. Are there any tests the doctor might want to examine, carry out an intimate examination? Then they might want to do tests to find out what is going on. So I think that is that for that particular question, which I thought was of interest. And to be honest with you, I do get a few comments about period blood, that's dark period blood. And yeah, there are instances when I would definitely be concerned it is not normal, and I've listed them, on our graphic here. But this is just a guide. And again, I have a video that's dedicated to this. So another useful thing that I should do would be to put it for you in the descriptions for this video, so that those that are particularly interested in that question, please go and have a look at that. All right, fabulous. You're making good time. Let us look at the very next question. Before we do that, of course, let me take a quick break. I shall be back with you. So here we go. Right. So the very next question, and thank you to the viewer. Here we go. Right, so this is one. I'm sure many of my regular viewers will know the answer to this question, but I thought I have new subscribers coming onto the channel every day, and there are many people who have these questions around fibroids, and I think it's important that we address them. So this lady says, I'm 8 weeks pregnant with my first baby. Congratulations. And have 1 fibroid. Okay. Before pregnancy, the size of the fibroid was 2 centimeters, but now it is the size 5 centimeters. I have no symptoms. What should I do? You know what? I mean, compared to the other, sorry, my earring is trapped under this thing. Compared to some of the other questions that we've seen, this has a bit of information. She's 8 weeks pregnant, first baby. She has 1 fibroid. That's useful information to have. 1 fibroid. And what else did she say? Fibroid has grown. From the time before she was pregnant, it was 2 centimeters. Now it's grown to 5 centimeters. So here, fibroids, just a refresher for those of us who are not familiar. Fibroids are benign growths from the womb muscle. They can happen singly, so you can just have 1, or you might have more than 1. commonly happen in 3 different locations from the muscle of the womb. The one that pops out of the womb altogether, that's the subserosal one, or the one that is seated right just inside the muscle, like this one here at the bottom, and then one that sticks itself into the womb cavity itself, where the baby would normally sit, or pushes itself into the womb space, into the it's into the womb cavity where the baby would normally sit. That's the best way to describe that one. I think this is mislabeled. This is actually a submucosal fibroid. I've just noticed that one, so I need to change this image. But yeah, so those are different types of fibroids. And so the question is, and this is a really, this is a really good question, because we're not going to spend the whole video talking about fibroids and how they grow and all the ins and outs, because we have lots of videos already on the channel. So please go and check them out. It's I think it's the understanding fibroids playlist, or there is the podcast, which is something about knowledge of fibroids, I think. But if you just search through, you'll find them. But why this is important is, we know a few things about fibroids. There's still a lot that we don't know. And in pregnancy, right, fibroids, how they would develop, or what they will do in pregnancy can be variable. It can vary from one woman to another. Okay, but thankfully we have some studies. Some people have sat down to observe different women to see, okay, what happens in this case, what happens in that case. So have a look at let me share my picture just to sort of get this into your mind and sort of prepare the ground for the conversation, which is this picture of a pregnant woman. You can see baby lying inside the womb cavity, and then you can see the fibroid. That's this grayish pinkish thing at the top here that is butting into, it's the muscle of the womb, but you can see it's sort of butting into the womb space, into the cavity, and you can see it might be pressing on the baby, or it might be reducing the space the baby has to grow, because baby's job is to grow inside here. And if you have this fibroid that's taking up space in the womb, it could affect baby's growth. Here's another one that compares a normal pregnancy to having fibroids. So on the left side, you have baby in the womb with its placenta and the umbilical cord, and then here you have baby with the fibroids. You can see the arrow indicating where the fibroids are, and how potentially, I mean, this one doesn't look to be affecting baby too. Oh, okay, actually, if you look at the space between the baby's head here and the womb lining, you can see there's a nice bit of space here, but here the space is narrowed because the fibroids are pushing in. The fibroids in the muscle are pushing on the space. So I just share that because that just gives you a bit of insight into what could happen, why the issue of having fibroids in pregnancy could be important. But let me start by providing a bit of reassurance, okay? Because I was saying that we have people who sat down and done these studies. Most fibroids, so if you have a fibroid, for most women, about 60%, maybe a little bit more, their fibroids don't change in pregnancy. I think it's really important to say that. And the other thing as well is that many women with fibroids have pregnancies. They don't even know that they have fibroids. They may have very small fibroids, or they have, moderate sized fibroids, but they're not just in a position that they can cause any bother to the baby. So pregnancy, mom and baby do absolutely fine. Okay, so the first thing to realize is that most fibroids really, really do not change in pregnancy. However, you do have a not insignificant, 30% is not a small, it's not small. So you have about 30% that will grow in pregnancy, right? 30% of fibroids grow in pregnancy, and particularly in the first trimester. So what's influencing the growth in the first trimester? Of course, is estrogen. Estrogen, progesterone are related to fibroids growth and development, as you well know. There are other things that possibly related. We don't know. We're still trying to work out, what makes fibroids grow in this circumstance, but then it doesn't seem to affect another circumstance. But when it comes to hormone effect, we tend to have agreed that it's something to do with estrogen excess or estrogen influencing the growth of fibroids. Now, of course, in pregnancy, you have estrogen and progesterone supporting the pregnancy. So the fibroids potentially could grow under the influence of these hormones. And so that's the question. And so 30%, around 30% of fibroids grow. And it's usually in the first trimester that the most of the growth is experienced. And something I thought was also interesting is that for some women, or for most women who have fibroids, they may actually observe that their fibroids shrink in the third trimester. So as the pregnancy is rounding up and coming to an end, and of course that could be for so many reasons, but the main reason is because the baby, of course, is growing so much bigger. The baby is now demanding the blood supply that was the fibroid was relying on, because remember, the fibroid is tissue and it relies on blood supply to grow, as well as effect of estrogen. But now the baby size, the big baby will demand a lot more of the blood supply, and it will starve the fibroid, and then that can lead to the fibroid shrinking. So those are some of the things that could happen to the fibroids when you're pregnant. Okay, but with that said, I would like to focus on those smallish 30% where the fibroids grow, and just for the sake of learning, and so that you're aware and prepared, not to frighten you, but we have to sort of meet the balance, because again, for this doesn't happen in the majority of cases. It's a small percentage of women, but we know that some of the issues that can happen if a fibroid is present in some women is they can experience pain from the fibroids. Now, the pain can be because the fibroid is getting bigger, and so it's pressing, and your womb is getting bigger, fibroid is getting bigger, and they're battling for space. Your body is only that size, so, or your womb cavity, the abdomen that the womb grows into, is only that size. So if it's a very large fibroid that's growing, it can press on different organs, different parts of the body, and contribute to pain, especially depending on where the fibroid is located. But there's also something else that has to do with the blood supply of the fibroid, that again, I talked about it losing access to blood supply because the baby is growing. Sometimes as the fibroid blood supply is lost, it begins to decompose. We call it degeneration, and that degeneration can come with a lot of pain. So something else that can lead to pain, and it can be quite severe pain, quite uncomfortable for a woman who has fibroids, that as her pregnancy is progressing and advancing, the fibroid that is decomposing or degenerating, and that is associated with pain. So that's one experience that a woman with fibroids may have, and the treatment usually is that we provide her with very effective, strong pain medication to help to manage the symptoms. The other things that could happen with fibroids in pregnancy is that the baby can grow very well. So if you have a very large fibroid, sitting in that cavity, let's go back to those pictures that we're if these fibroids are quite large, they might just make it difficult for the baby to grow well and to take its full size in the womb. So it could affect the pregnancy such that the baby doesn't grow as well as it should. Something else that could happen, of course, is the possibility of miscarriage, because, and this is early on, if the fibroid is positioned in such a way that even after the baby fertilization has happened and the baby has planted inside the womb, because the fibroid is there, it doesn't allow for smooth growth of the baby, and the miscarriage could happen. The other thing as well is the fibroid being present could cause the placenta to come away suddenly, just lose its attachment to the womb, which is called placental abruption, and that could happen because the fibroid is there. And again, preterm labor, the womb, so this is in later stages of pregnancy, it's supposed to carry to 9 months, but because the fibroid is there, and the womb is growing, the fibroid might trigger the womb to start contracting, and because of the contractions, the woman could go into preterm labor. It could cause the cervix to open, and she could go into preterm labor. Other issues that could happen, of course, C-section, breech position, you can imagine, or in fact, conveniently, my photograph even shows that one. So here's a breech position baby, because of the fibroid, even though I don't know if I can blame this fibroid exactly, but Yeah, well, you could actually, because baby might not be able to turn properly because this fibroid is in its way. If the fibroid wasn't here, the baby might have been able to turn. So it's possible that having fibroids could limit baby's movement so that it stays in a bridge position. And of course, having fibroids, again, depending on the position of the fibroid, what if it's located near the cervical opening, and so it's preventing the baby's head from descending into the vaginal canal. That means you might need to have a C-section. So these are some of the complications that can happen with fibroids and pregnancy. I I like giving information so that we're balanced, but I don't want to scare anybody. Let us go back to this question and try and see if we can answer it to some degree, just to provide guidance. Because again, my lady here needs to be sitting with her doctor, her obstetrician, and going through things so that she's reassured, so that she knows what to do, and so on. So the fibroid has grown from a small one to one that is moderate size, 2 to 5 centimeter, but she has no symptoms. Okay, she has no symptoms. Oh, and I didn't say something. Usually, in pregnancy, we don't do anything about fibroids. Usually, so pregnancy is not really the time when they will start trying to give you drugs to shrink fibroids, or trying to cut or remove the fibroids. That usually does not happen. In fact, for drugs, it doesn't happen in pregnancy. For surgery, it doesn't usually happen. There might be some cases, rarely, where maybe because the fibroid is causing pain or discomfort and it is felt, it is in a position where the surgeon can easily reach it and they are not going to enter the womb cavity at all, then that may be considered, but very rarely. So bottom line is that fibroids are usually left alone and not touched during pregnancy, unless they're really causing a problem, and the risk of touching, of dealing with them versus leaving them alone, you have to weigh the risks to work out which is best for both mom and baby. But she said something I thought was interesting. She has no symptoms, because most, I'm pretty good, sure, I'm pretty certain, I think that's what I'm trying to say, that her doctor will probably say, do nothing. Just watch it. Let us monitor it. That's basically what's going to happen. She has no symptoms. She's probably going to be reassured, but she should be told of what could happen. And again, I don't know what could happen. It depends on the type of fibroid, where it's located. Let's have a look at our picture again. Is it within the womb lining? Is it soft subserosal and pushing out into the outside the womb, or is it within the muscle, or like one of those that's pushing into the womb lining? Again, apologies for this image, which I've got to remove actually because it's not properly labeled. So it depends on the type of the fibroid. It's your 8 weeks, so you're in 5 weeks you'll be entering your second trimester, and perhaps the fibroid might stop growing at that stage. The biggest growth tends to happen in the first trimester. Not say that it can't grow subsequently, but we don't know, it might stop growing as your pregnancy advances. It might be in a position where it doesn't cause you any pain. So please don't panic. Speaking directly to the lady who asked our question here, don't panic. Speak to your doctor about your condition, about the fact that you have no symptoms, which is reassuring. Please don't do, and there's nothing that you need to do in terms of taking any medicine or any drugs. No, you need to sit down with your doctor. If you're experiencing pain, they would give you something to control the pain, or give you or suggest different options, because it might be that you need to rest more, cut your working sessions or working pattern down a little bit, and take painkillers to help to manage the pain. And yes, there are some painkillers that you can take that are safe for both you and the baby in your pregnancy. So these are some of the considerations I think that you should have. Right, my friends. Yeah, I think we've covered those really good questions for the week. I hope you found them useful. And again, I really want to express my appreciation to the people that sent in the questions. It's always very useful. It allows all of us to learn. And I encourage you to please keep sending them on. Okay, and just a reminder, let me share my screen again, that we're doing perimenopause chat starting next next week. Next week Thursday, the first videos come out next week Thursday, and then Sunday. I'm not sure if I'm going to do a live on Sunday. I've not yet decided. It depends on what my schedule is like. But yeah, I'll let you guys know if we're doing a live or whether we're going to be doing a published video. That's not a problem. What I'm really interested in is I want to hear from you. What are the issues around perimenopause? There's so much conversation going on around menopause, which is really great. We're doing a lot more talking about it. Perimenopause is a very important aspect of the whole transition, and I think that we're so much focused on the menopause conversation, which is when the periods stop, but the years before we actually get to that point where things are changing. Many women are experiencing things that they don't understand, and I think we should have a big focus on that as well. So I want to hear from you. Please send in your questions around perimenopause, and let's make this October month, Menopause Awareness Month. Let's make it a month where we learn and hopefully engage with conversation, supporting each other around the issues of menopause, getting stronger, and finding solutions that are effective for everyone, every one of us. Thank you so much for watching, guys. I appreciate. Please don't forget to give the video a like, and look out for the videos that I'm going to link in the description box, probably within the next hour and a half when I get off the stream. If you're interested in those topics that we've talked about, period blood, genital warts, and of course the fibroids playlist. All right, I'll see you again soon. Bye bye, guys.